Hello, my friend, and thanks for joining me. I'm glad to see you back again. Please take a millisecond and hit that subscribe button. If you do it right now, you won't lose me. I'll still be here talking. Anyway, but it would mean the world to me if you would subscribe. All that does is when we post a new video, it will just go into your feed. That's all. It just sends it to you. But it really helps me out by telling YouTube that you like me. So, okay. Today, I'm going to discuss the stages and the progression of Lewy body dementia. Defining stages in Lewy body dementia has some controversy around it. This type of dementia is particularly difficult to define stages or phases, but I feel we really need at least an outline or a guideline to use. So I did a lot of research as well as used my many years of professional experience with patients to bring you the most accurate information possible. We already know that any person with any type of dementia will have a different experience and journey. This presentation is to help you not necessarily determine a particular stage, but rather as a tool to understand the severity of the symptoms, the severity of early symptoms, and the difficulty to diagnose this devastating disease. This is the second most common form of dementia, second to Alzheimer's disease, that holds the #1 spot. Research shows that we are experiencing brain cell death anywhere from 20 to 30 years prior to showing any symptoms. Isn't that amazing? Incredible. Lewy body dementia is a progressive, degenerative disease of the brain, and there currently is no cure. Before we get started, it's important to note that unlike other dementias, Lewy bodies will have very intensive symptoms early on in the disease process. The average life expectancy for dementia with Lewy bodies is generally 5 to 8 years after being diagnosed. I'm Debra, your advisor and educator for everything Alzheimer's and dementia. Now, again, it's important to acknowledge that 80% of Lewy body dementia is misdiagnosed. 80%. Doctors who are not experienced with Lewy bodies and other dementias are likely to misdiagnose. This is important because some doctors refer their patients to neurology long after important warning signs have been recognized or family has raised concerns. On average, a diagnosis for Lewy bodies will take 18 months. There are many reasons why diagnosis is difficult for a doctor that doesn't specialize in dementia. Those reasons are because the early warning signs mimic some of the same characteristics of Parkinson's, REM sleep disorders, Alzheimer's disease, and psychiatric illnesses such as schizophrenia. Doctors see the individual symptoms of hallucinations or the sleep disorders and then, unfortunately, misdiagnose. With Lewy bodies, unlike Alzheimer's disease, the prevalence of cognition issues are typically minor until a little later in the disease progression. Early detection of dementia with Lewy bodies is very important for maintaining quality of life and to ease the severity of the symptoms. Dementia with Lewy bodies is caused by abnormal deposits of a protein in the brain, causing a disruption in the communication between the brain cells, affecting memory, critical thinking, physical movements, sleep disruptions, and often violent hallucinations. This is a progressive neurological decline resulting in death. As Lewy bodies develops, the early warning signs are frequently misinterpreted by medical professionals as mental illness or sleep disorders. The early signs include hallucinations, episodic sleep disruptions, and periods of altered alertness. Starting with hallucinations, these hallucinations are vivid and can commonly include people, children, shapes, and animals. In the early stages, Lewy body dementia will not typically include debilitating memory loss. However, more common, the patient will have fluctuations in alertness. They may have difficulty with concentration and may feel unusually tired. Another early warning sign is a subtle change in movement and motor skills, similar to Parkinson's. The person with Lewy body dementia will have problems with balance and coordination, resulting in falls. The next early warning sign is sleep disruptions. Sleep disorders are very common with Lewy body dementia. This symptom is frequently overlooked or misdiagnosed. Sleep that has vivid dreams, acting out violently, or sleepwalking are signs of Lewy body dementia. A person with dementia with Lewy bodies frequently will act out their dreams and become violent. This can be very, very unsafe for the caregiver, as it is not uncommon for the person with Lewy bodies to physically attack their care person. I have more regarding this in my other video about Lewy body dementia. The risk factors for this devastating dementia include age and sex. If you are over the age of 60 and a male, you are considered at higher risk. If you have a history of a head injury, a history of anxiety or depression, these also increase your risk. And if you have a family history with a first-degree family member like a brother or a sister or a parent who has had Parkinson's disease or been diagnosed with dementia with Lewy bodies, these all increase your risk. Let's now discuss the phases or stages, starting with stage 1. Stage 1, the person may be sleeping more during the daytime hours. They can already begin having hallucinations, and they could have REM sleep disorder along with restless leg syndrome. They may be misdiagnosed with Parkinson's due to the symptoms of tremors and issues with gait and the onset of falls. Your person may also have long periods of either confusion or just a flat, almost trance-like appearance. They will appear to just look off into space. These episodes can last minutes, hours, or even days. And if that's not enough, they can experience several days in a row with no cognitive issues, making it difficult to decide if there really is a problem or not. Stage 2, at stage 2, family is now very concerned that something is really seriously wrong. This is when misdiagnosis is a risk. Symptoms are more prevalent, an increased risk of falls from balance issues, masking as Parkinson's symptoms, occasional incontinence, maybe 1 or 2 times a month. There will now be signs of autonomic dysfunction. This is when this system begins to fail and the person has problems regulating their own body temperature. They might be sweating or fainting due to the body's inability to regulate the blood pressure. They may be experiencing a dry mouth. At this stage, the person will have more trouble finding the right words and organizing their thoughts. Paranoia, aggression, and anger are increasing. Stage 3. In stage 3 or stage 4 is usually when the diagnosis is corrected if it was misdiagnosed prior. Now we will see an increase in incontinence. This person will not be able to work or drive any longer. They will need assistance with many of their personal activities. The autonomic functions will be decreasing, and they may have fainting spells due to a lack of blood pressure regulation. They will have trouble paying attention and concentrating. The person may be having hallucinations for a while now and maybe having been misdiagnosed and improperly medicated. The wrong medications for a person with Lewy bodies can be devastating. Hallucinations are vivid and can commonly include people, children, shapes, animals. Studies show that up to 80% of people with Lewy bodies will suffer from hallucinations. Stage 4. At stage 4, by now, you're able to get a correct diagnosis of Lewy bodies dementia. This stage will show consistent trouble with motor skills, tremors, and sleep disruptions are prominent. At this stage, they may also have problems swallowing, drooling, aspirating, and choking. They will have difficulty with speech, and they will be limited to short, simple sentences. Now is when they will be at a high risk for frequent falls and beginning to sleep more during the day. If they are still suffering from hallucinations, at this point, the hallucinations are not as bothersome or scary to them. At stage 5, this patient is requiring 24-hour supervision, has a high risk of aspiration, and that means choking and getting food or liquid into the lungs. They are in need of transfer assistance and are becoming less and less able to communicate their needs and desires. They may experience fevers due to the inability of the body to regulate its own temperature. This person may now experience muscle contractions or rigidity involving their arms, their legs, and their hands. The last and final stage, severe dementia, very severe cognitive decline. This person will require constant 24-hour care and be bedridden. During the course of this final stage, communication will cease and the person will not be able to express their wishes or desires. They will still understand a kind person and can sometimes tap or hum to music. At this last stage of the disease, the person will be completely dependent on others for survival. The final end of stage 6 results in the brain no longer signaling to the lungs to breathe and the heart to beat, resulting in death. So there's the stages or phases, if you will, of Lewy body dementia. Nothing about dementia is easy. It's brutal for everyone involved. So be kind to yourself and to those you care for. Rest assured that I will always be here for you. When you tap that subscribe button, you'll then get our great videos in your feed when we post them. Just makes them easier to find. We are uploading a new video every Tuesday and every Friday. Let me know what questions you have. Together we can. See you next time. I'm Debra Costu. Are you a nurse, a doctor, or an aide, dining server, or in housekeeping in a senior living setting? Would you like to go to work every day knowing exactly how to handle any situation that arises with a person with dementia? Then head on over to my website, answersabout.alz.org, and get on the mailing list so that you can be notified when we launch our new certification program. I'll guarantee that you can get the same results. Join our modern dementia care strategies. To apply, go to answersabout.alz.org or call us at 585-775-5949.